Thank you very much, Pink Africa. Thank you for the opportunity to be part of this great seminar. I am very delighted. So I'll be presented the ISLAC ASLC language guide, and prepared by Jill, Sara, and myself. Yeah, so setting the stage, the difference between right word and all rights, almost all right word is, the difference between lightning and lightning board. Lightning board is what we call, like, as in the fly, that you see, as in that carries, lights. So there's a difference between lightning and lightning, bird, by Mark, an American author. Next slide. So now, right, this is a continental presentation of continental forum for people all over Africa. So when someone is diagnosed with cancer generally, whatever cancer it may be, globally, you see the supports. It's not that way in Africa. We don't see that much in Africa, but in the Western world, you see a lot of love, you see, a lot of support, we are with you, you are not alone, but when it's, lung cancer globally, both in Nigeria, all over Africa and the world, there's this, blame, like, the first question you get is, do you smoke? Are you a smoker? I can say to myself, I was a cancer advocate since 2008, and all I thought about lung cancer was, if you don't smoke, you don't get lung cancer. Not until 2017 that I lost someone very close that never smoked, so quickly to lung cancer, and that changed my perspective. And from that year on, I became a lung cancer advocate. I'll be playing a 3-minute video just around the language guide.
The first time I experienced the stigma surrounding lung cancer was as a teenager, almost 39 years ago. My dad had just died of lung cancer at 41 years old. One of my very close friends asked me, "Why are you not in a good mood anymore?" I responded and said, "Well, I miss my dad." And my friend's response was, "Well, my mom said it was your dad's fault because he used to smoke." The emotional scars left on me at 13 years old are with me forever.
We're convinced, we as a society are totally convinced that the reason that I got lung cancer is because I did something to deserve it. I earned it. I went out of my way to go and smoke and shoot.
I lost some friends because of my lung cancer. When I opened up and told people that I had lung cancer, they shied away from me. They felt I caused my lung cancer.
When I would tell people I had lung cancer, the first thing they asked me is if I smoked, or how much I smoked, or when I smoked, or I didn't know you smoked.
When we talked about people talking about their smoking history, he looked at me and he told me that people always lie about their smoking history. And that just cut me to the quick.
I've had people tell me I'm lying, I'm scamming, because I don't look sick, because I work out, because I travel, because I'm living life with lung cancer.
In 8 years of a lung cancer diagnosis, you meet a lot of physicians. And the best ones, the ones that I knew had my back and were really looking out for me, are the ones who came into the room and really just assessed the situation, asked me questions about how I'm doing, how I'm feeling, treat me as a patient, as a human, and not as somebody who might have smoked or somebody who did this to themselves in some way. Those are the ones who I've always gotten the best care from.
Being somebody that used to use tobacco, I said that I would want to see things like how people quit smoking.
I wanted doctors just to understand that non-smoking younger people could get lung cancer.
So I walk in, I meet you for the first time. let me know you're on my team. We're in this together. I want to be able to know I can trust you, and this is how you can do it. Let's do this together.
Just treat me just like any other human being with any other disease. Treat me for my disease. Don't saddle me with this stigma.
Words are powerful and they're important. And beyond those words, compassionate conversation is at the heart of a patient's experience.
Thank you very much. The language guide is not about, do's and don'ts, don't, do this, don't say this, don't say that. It's a living document that, we, in the thoracic sphere, not just only thoracic, all around, as in cancer community, we want, people to, watch, the language, the 4 pillars, use, person first language, eliminate the blame game, you smooth, and that's why you have lung cancer, end the stigma, and equity. Next slide. Yeah, so these, are like, languages, like that you could use, rather than saying go to the next slide. So I just I wrap the 2 slides are the same. So rather than for person first language, try saying the person or patient with lung cancer, or patient with breast cancer, rather than saying breast cancer patients. Like it's an attachment. It's like something that they caused themselves, or cancer progressed, say cancer progressed instead of, patient progressed. These are languages that we see even in the scientific, writing that has been done. So we want, if people can be empathic and adopt, this person first language, and the blame game as well, where, as in treatment failed the patient, not that the patient failed treatment. These words, it might mean, little, but it goes a long way. And in our society in Africa, where, the doctor is the king, the doctor is like the god. So whatever the doctor says, sticks. So we need to, as, HCPs, healthcare providers, to know the kind of languages or words that we say, to the patients, or end the stigma, in terms of smoking, instead of saying smoker, you could say person who smokes, or instead of saying nicotine addict, you could say nicotine dependence. So these languages are things that we in the guide you would see, and it will help you. Like I said, it's not about do and don'ts, but it's a living document that could just help the language in how we talk to as in people in the community as healthcare professionals. Next slide. Yeah, so next slide. Yeah, so it's not just about IASLC. We are seeing a lot of people, adopt this language, or we're seeing ASCO adopt, and journals as well, adopt these guidelines, and we all need to come together, to really watch, our language, and know that the patient, the patient is important. You'd have to be empathic, and thanks to the doctor that spoke. He actually drove down a lot of those points. Next slide. So join us in implementing the language. I'm sure that Pink Africa shared the language guide, the PDF. So you could go through it. If you have any questions, you can go to the website islac.org. Yeah, and definitely there'll be someone to answer you. Next slide. Yeah, so in completing, I'm calling, people, because there's something that happens. I've seen, a lot of breast cancer patients, most of the time as it metastasizes to the lungs, and it's a short space of time. I was in Lagos last 2 weeks ago, and they were telling me about a patient who there was metastasis to the lungs, and quickly, she her condition deteriorated. So want to call on people in the breast cancer, cervical cancer, prostate cancer community, to come and learn more about lung cancer. And the truth is that in Nigeria, a large percentage of people who have lung cancer are women, and a large percentage of people who have lung cancer never smoked, never used tobacco. So I'm calling on you. The application is on about the STARS program that we could learn more. So you can be able to benefit. It could be because what we're doing is how does this benefit the patients, patients in Africa, how the standard of care could actually change for not just lung cancer patients, but all patients around, Africa. Next slide. So thank you. That's my email. And as well, you can reach out to Pink Africa, and they would, as in reach out to us. And thank you very much for having us. We together we would make cancer a word that people will not be scared of anymore. Thank you.
Thank you very much, Mr. Caleb. Thank you so much. While that video was being played, I was also getting emotional myself, because I can imagine what those survivors. I mean, I must confess, I used to be one of those people that thought that, if you have lung cancer, you must have been a smoker. So, and now we are seeing that, just like you mentioned, that even a lot of women even have this disease. Someone posted a statement in the chat while Dr. Otene was presenting, or after he presented rather, that Ruth, this is Ruth. Empathy is trying to put yourself in the patient's shoe and understand their situation. I think if every one of us looks at things, persons with cancer. I'm trying to correct my language now, because I saw one of the slides. It's not cancer patients, it's persons with cancer. Am I correct, Mr. Caleb? Is that the right language? Let me start to practice. Okay, so it's person with cancer, not cancer patients. So I'm already practicing it.
Yes.
So if we ourselves put ourselves in the shoes of the persons with cancer, our loved ones, I've had loved ones, how would you want to be treated? How would you want to be addressed? How would you want to be spoken to? I think if we always have that at the back of our mind, it helps us to use the right language when communicating with these people. Thank you so much. Thank you for the wonderful work you're doing, yourself and Jill, Mama Africa. Thank you so much. Really, really brilliant. Thank you for the advocacy. We cannot have enough of advocacy. There's still a lot of room and work to be done in the area of advocacy. Thank you so much for that wonderful presentation. Thank you so much. Yeah. Before I call on the next speaker, we have another wonderful presentation coming up by a brilliant oncology nurse in the United States of America. I'm going to invite one or two survivors to speak, people like you and I, to share their story in a very short 3 minutes. So the first person I'm going to call is Inyang Inta.
Good afternoon, all.
Oh, okay. Inyang, thank you. Good afternoon.
I'm Inyang Inta. I'm a Nigerian. I was diagnosed of breast cancer in 2017 at the University of Calabar Teaching Hospital, Calabar. In 2017, I've done my mastectomy. I'm about 7 years old in this process. I want to thank God for my life. One, I've done my chemotherapy. I did my chemotherapy in teaching hospital. Then we didn't have a cancer center here, so I was referred to Lagos to do my radiotherapy. So thereafter, I've been surviving. I want to thank my caregivers. I want to thank my family, my church members, my friends, Cancer, you cannot fight cancer alone. So I want to really give kudos to Pink Africa Foundation. From time to time, they will call me to find out, have you gone for your checkup? Your checkup is due, you have to go for your checkup. Make sure you go. So I want to say a very big thank you to Pink Africa Foundation. I want to encourage tumor in your body. Please go to the hospital. They will ask you to do a few tests. Most of them are not cancerous. Some people go, they remove the lump, and that is it. So it's not every tumor or every lump that is cancerous. So not that once you hear you have a lump, you say, it's cancer. Don't tell yourself you have it. Let the doctor go and diagnose it and tell you what to do. And please, whatever your doctor tells you to do, do it. Because there are so many people who tell you, do this, do that. Don't go to the hospital. Once you get to the hospital, you will die. They even told me that I should run away when I went to the hospital. So I want to thank all my caregivers, especially Pink Africa Foundation. Thank you very much.
Thank you very much, Ma. You look so beautiful. You said you're surviving. You are not surviving. You're thriving. You have defeated cancer already. So I don't want to use that word surviving. I'm sorry. You're actually thriving. You have conquered cancer, and you look so good. I mean, I'll see you on the road and wouldn't even think anything happened to you. And that's the message we're trying to pass across to people. Cancer is not a death sentence. It doesn't mean that you cannot live life like every normal person. So thank you for sharing your story. I'm sure you've inspired one or two, many people who are here, even if they don't have cancer, but maybe have loved one, or like Caleb, will become advocates in the future. And thank you. I'm going to call on Infon, the next person, to quickly share her story to Infon Idio. Please, I apologize if I'm not pronouncing the name correctly. Yes, good afternoon.
Good afternoon, everybody. Sorry about that.
Yes.
I'm Farah Basidio. I'm thriving, according to your words. So I'm a breast cancer survivor. I was diagnosed of stage 3 triple negative breast cancer in 2022. To the glory of God, the whole journey took 8 good months, and I scaled through it and I survived. I'm doing well. I'm thriving, as our moderator said. Then I want to streamline my story to the area of our concern today, our topic area, which is about stigmas and abuse. For me, I won't call it stigma. For me, as my own experience, what I experienced some abuse of professionalism, yes, from the healthcare personnel at different points in my treatment period. So I'm going to really pinpoint the 3 key areas I experienced this abuse. The first one was 6 months post lumpectomy. I done lumpectomy 6 good months. The doctor didn't tell me what I had was breast cancer. You understand? For good 6 months after the lumpectomy, I had gone back to work, and I was getting feedback from the doctor, asking him what the result was. He told me that my result is clean. I should relax. And I had a little relief from hearing that from the doctor. So, but after like 6 months, when I relocated back, I had to go see the doctor myself. When he checked me, asked for my folder, he brought out the result. The result was my histology result was folded and in the envelope. I mean, it was obvious that he did not even open it. So I was like, you told me my result is clean. Then what is all this? So I became calm. So another area I experienced professional abuse of professionalism was when one of the days I went for my lab session to get my blood for the full blood count and all the procedure we passed through before the next chemotherapy session. The lab scientist, on taking my blood, he noticed my blood was foamy and dark. You understand? So the lab scientist, instead for her to have mind her work, you understand, she started giving me orientation on HIV. Is not a death sentence. And some people that are living on HIV, that are getting married, that are having children, that are doing this. If I was not aware, as in I was not enlightened, at least to have known one of us in the the one or two things about the effect of chemotherapy on my blood, I would have just gone back home that day feeling that plus the cancer I was fighting, that means in front of you have HIV on top. So that was uncalled for me. And then another part which I experienced or abuse of professionalism was during when I was asked to do immunohistochemistry test. So I've done that. I got the result. So the day I wanted to go and collect the results, I went to the office. I was waiting for my result to be printed for me. Then one of the ladies came in. She's a medical personnel. She was busy talking about triple negative, that is a death sentence. She knows what she's talking about, triple negative. When some other colleague were trying to tell her, no, it's not a death sentence. She said, I know what I'm talking about. I'm talking from experience. Triple negative, as long as the triple negative is the death sentence, it's a death sentence. The end product is dead. I was just keeping quiet. The highest thing I could do, I was with my phone, just lifted my eyes, looked at her. Then I returned back to my phone. Then just behold, when my result was printed to me, I checked my result. It was triple negative. So if I wasn't enlightened, because I told myself, even if it's triple negative, according to her that she said it's a death sentence, even if 99 people that have been diagnosed with triple negative die, that is their own portion. I will see the end of cancer. Cancer will not see my end. That was what I was always telling myself. So, but at least I was enlightened to have known that people still survived. So these are the three level key area I experienced abuse of professionalism, but I was lucky to have been a little bit enlightened to have understood some of those things and did not allow it to get into me. But what if it had happened to somebody that wasn't enlightened? Do you understand? And somebody that was not faith-filled. Do you understand? The person would have even died before she even had the chance to have finished her treatment. Thank you very much. Thank you for the opportunity. Thank you, Pink Africa. Thank you, everyone. Thank you, our presenters. Thank you for all the lectures. It's been very, very insightful. Thank you very much for hearing and listening to my story.
Thank you so much, and I'm so sorry to hear about all that you've passed through. First of all, how are you? Are you feeling? Are you okay? How do you feel?
I'm fine. I'm very, very fine, as you can see. I'm very fine.
Yes, you're looking very beautiful. Thank you.
I did my work post treatment checkup 1 year after the X-ray, the stomach scan, everything came out very fine. And even my daughter was telling me, whatever you are doing, continue doing it. They are doing amazingly well. So I'm doing amazingly well. Thank you.
We celebrate you. We celebrate you.
Thank you.
And these are the kind of stories we want to hear. Thank you so much. On behalf of all the health workers in Nigeria, in Africa, all over the world, please, we apologize for the abuse in your own terms, that you had to endure during your journey of cancer. You'll be surprised and that's why this training is very important. Thanks to Pink African Foundation for organizing this training. It is very, very important. You'll be surprised that even a lot of cancer is still a strange, as common as it may sound, it's still a strange name, a strange disease. People still do not understand. Even the medical community are still trying to understand cancer. So I'm very sorry. I'm very sure those health professionals are now better. They are more educated now, and nobody will have to go through what you went through. And I'm so sorry. I was feeling so bad while you were speaking, but I'm so happy that you're doing well now. Thank you so much. We love you on behalf of everyone here. We love you and wish you all the best. Thank you.